Well, thank you very much for the question. I appreciate it very much. Obviously, I'm on record from the spring saying that had I been in the United States Senate this spring, I would have voted for the health care reform bill. That's not to say that I don't have some misgivings about it. That's not to say that I think it is a perfect bill. It's not. It's essentially an access bill, and I don't think the United States Senate or the United States Congress did enough to control costs. And that's what this is really about. It's how do we control costs, but it's also about, well, what does this bill potentially do for you working on Kentucky farms? I supported this bill because on balance, after decades of trying to deal with the health care issue, here was an opportunity to do a number of things. One, to provide health insurance coverage for about 654,000 Kentuckians who are currently without it. Think about that. In addition to that, many of you who have family members working on farms, you can now have children covered till the age of 26. No longer can you be denied coverage for a pre-existing condition. COBRA rights are extended. A number of patient protections are brought forward to help people to combat some of the worst insurance industry abuses. That's the reason I would have voted for it. That's the reason I think it can be of assistance to you, quite frankly. If you take a look at the bill, it's estimated the bill is going to provide subsidies for health insurance premium payments for about 45,000 Kentucky businesses. Some of those businesses may be your closely held farm corporations. So on balance, I think it was a good thing. More needs to be done to control costs. I've stated for the record, and I state for you again here today, the first bill I will introduce when I'm elected to the United States Senate is a bill to allow the Medicare program to engage in negotiations for lower drug prices. And we allow the VA to negotiate in bulk for prescription prices. We allow the Medicaid program to negotiate in bulk. And I have some experience with that because I've tried to save our Medicaid program a lot of money by going after pharmaceutical companies that abused it. But if we were to allow the Medicare program to negotiate in bulk, the estimates are that it would be about $200 billion in savings. $200 billion in savings left on the table because of a sweetheart deal with the pharmaceutical industry. That'd be one of the first things I would try to change. Secondly, we need to have Medicare fraud units in each and every state, whether they're run by the Attorney General or someone else. Running Medicare fraud out of a big bureaucracy in Washington is just not going to work. One thing I know as Attorney General, from having saved the taxpayers over $100 million by going after Medicare fraud and increasing Medicare fraud collections by over 600%, is that when you're close to the ground, when you're investigating close to what's going on, you do a better job. And estimates are that there are about $100 billion in Medicare fraud out there as well. And that's something I'm going to push for when I get to the United States Senate. So those are two steps, two concrete steps, where we can control the costs going forward. But I would have voted for it because on balance, I think it's a good thing. It increases competition. It has the potential to lower premiums. And I'm willing to take a chance on this particular issue that's so important to so many people.
I think this is another area where there'll be a clear distinction. I think the government taking over healthcare is a disaster and would have voted against President Obama's plan. There will be a lot of these distinctions where my opponent is in support of President Obama's agenda and I'm opposed to it. He mentions, Medicare negotiating drug prices. Well, guess who made the deal? President Obama made a deal after he pledged in the campaign he wouldn't make a deal with Big Pharma. He did make a big deal because it came up and they were going to have negotiation of drug prices and they excluded that in a secret deal that President Obama made with Big Pharma. Jack supports the plan, so I guess he supports the deal. Doesn't seem to make much sense to me. The health care plan, $1.2 trillion. They tell us down here, they say, well, it's not going to add anything to the deficit. Well, it's like $1.2 trillion and it's not going to add anything to the deficit. It's going to be basically free. Well, government is notoriously wrong in their estimates. When they passed the Medicare prescription drug plan in about 2004, 2005, they said it would cost $400 billion and it's now over $1 trillion. When you make something free, people use more of it. We have a plan like the Obamacare plan in Massachusetts now. It's already running 2 and 3 times over budget. What's going to happen is businesses, farms, people who buy insurance, who've been paying for insurance, are going to pay more. It's going to be guaranteed issue now. They can't differentiate on individuals. everybody's going to pay the same and everybody's going to pay more, and someone's got to pay for those who they're now insuring, which means those who've been paying are going to pay more. Not only do we have a disproportionate amount of the taxes in our country being paid by farmers and business, now we're going to pay for the health care that way too. But it basically is redistribution of wealth. Recently, President Obama appointed, in a recess appointment, a radical by the name of Berwick, who says that his goal, he's going to be head of our Medicare now. This is President Obama's appointee. He says that basically the envy of his dreams is the British system. That's a system where the government completely controls health care, and at any one point in time, 1 million people are waiting in line for their health care. Nancy Pelosi says, oh, well, you'll figure out what's in this health care bill after 6 months or a year afterwards when all the rules are written. They haven't written all the rules yet. I'm concerned that my insurance will not be on one of these health exchanges. I would venture to think that a lot of farmers have health savings accounts, take care of themselves, and like to be able to save in a health savings account. The Democrats hate health savings accounts. There's a good chance that these won't be in the health care exchanges when they come down, or maybe your plan's not in there and you have to switch. I think it'll be a disaster for us. Companies are already talking about it. I think AT&T said it cost them $1 billion. Some companies are going to simply opt out. What happens in Massachusetts is it costs too much money. You can get it anytime you want, so why prepare when you're not sick? Wait till you're sick to buy the insurance. It's going to be a disaster. It will do nothing to control costs. Everybody's insurance is going to go up. It will cost way more than they've pledged to. I think the way you control costs are very simply, what you need to do is expand deductibility for businesses on their insurance, make it easy to buy and deduct your insurance for individual entrepreneurs as well as companies. And I think there are a few reforms we'll get into, but just myself.
In this country.